I think that anyone getting a diagnosis of cancer, your first reaction is like this total shock, and then, I hate to say it, but you think, am I going to die? So it's really hard processing that. It's like your mind wants to just shut down. My husband had been diagnosed with colon cancer, and he was there for, I think, his first treatment. And Mary Lou came by and asked him if he wanted to have a foot massage. And my husband was pretty anxious. He'd never been ill in his life, never been in the hospital, and now here he is with stage 4 cancer, colon cancer. So I said, massage is really good. You should have her do it. And he's like, well, okay. So, here he takes his shoes off. Actually, Mary Lou helped him take his shoes off. And she gave him a massage, and it really made a difference. Mary Lou really, relaxed him.
As I think about how integrative therapy, like I do, works with allopathic or conventional medicine, I see that when the body is allowed to be relaxed, when the potential stresses of just having to go to the doctor, having to have chemotherapy, and the side effects of that, how it really becomes monumental on that individual. And when they can put all of that aside, and it allows all of their muscles in their body to take a break. It allows their brain to be in charge again. Having these
non-drug, non-Western medicine kinds of treatments, they really helped him with the anxiety piece of it when he was there, so he got to where he was just pretty relaxed about going in for treatment. And he would say, I asked him, don't you hate going in? He said, no, actually, I know that's where they're going to heal me. And, and then Mary Lou comes by and gives me those foot massages, and I go to sleep, and it's like really wonderful, And, having the ear seeds, he didn't have to take as much of the other medications, for his nausea. And that made him so that he was more functional and not sleepy all the time and stuff. So he was able to still do a lot of things normally, even though he was doing some really heavy-duty chemotherapy. So I think it really improved his whole quality of life, during the time that he was doing chemo, which was pretty much the whole 5 years that he was with us. My daughter got married last year, and right after her wedding, I found a lump in my breast. I told her, I said, this doesn't feel like the other lumps I've had before, and I'm thinking it's cancer. After I got diagnosed, it was a shock for me, of course. I'm thinking, okay, I've already been through so much. Now this, And the first call I made actually was to Joyce Smith, at the hospital, who had helped us so much with Robin. And then the next call I made was to Mary Lou. And I said, Mary Lou, I haven't talked to you for a really long time, and I've been doing okay, except for I just got diagnosed with breast cancer, so it looks like I'm going to be doing some chemotherapy, and would you mind coming and giving me those foot massages? And she said, sure, of course I'll be there. You tell me all of your appointments, I'm going to be there for every one of them.
I started working with Myra in the infusion bay. I was doing foot massage with her then, and I know she would say, oh yeah, I know I'm so stiff, I can't seem to let my foot go. So I'd say to her, let your body just feel like a wet noodle. And after a few times, she saw the difference, and I saw the difference.
Mary Lou did several sessions of massage therapy for me, and then what really helped a lot was She walked me through visualization, and so I found that to be really helpful when things were really bad, to kind of take that deep breath and kind of put myself in a better place.
Before we begin this session, I asked them to do a little 5-point assessment. On a scale of 0 to 10, I asked about pain, with 10 being the most and 0 nothing. Pain, fatigue, stress, anxiety, or nausea, and then about depression. I asked before and then after the session to see if there's been a change. I'd like to see if I've done any good.
And I think that what the integrative medicine or alternative medicine helps to do is that there's so many side effects of the chemotherapy, and the side effects for me are what keep you from having the life that you want to continue to have while you're going through treatment.
Just allowing them to be on the table and be relaxed. Sometimes it's as simple as that. To allow their body and brain to connect again.
I think one of the things that's really important about integrative medicine is that I found that Robin's doctors and my doctors were really open to it. So when I asked, is there something else I can take or something else I can do, or can we try this, they were really open to saying, yes, that'll be okay, that won't interfere with the chemotherapy. I didn't find that to be the case with some of our friends who have doctors who said, absolutely not, you can't take anything, nothing, you can't do that, you can't do this, So I really appreciate that they were very open to it. And then I also want to say that it is really important that you not take things without asking your doctor.
When I see something that seems a little off, I invite the individual to check in with their doc and see if that's something that they need to know about.
So I think that when you have cancer, you really have to treat the whole person, because it's not just the cancer alone, it's all of the effect, including the emotional effects.